Hello, I'm Dr. Bill Waggoner. Welcome to today's Tuesday Tip. Today, I want to address two frequently asked questions about NeoMTA 2 and NeoPUTTY, but this tip also applies to any MTA product. The first question is, do I need to cover MTA products with anything prior to placing a final restoration? The second question is, if I do need to cover it, what should I use? Let's consider the first question. Do I need to cover MTA with anything prior to placement of the final restoration? The answer is, it depends on two things. One, have you completed your preparation? And two, what is your final restoration going to be? A crown or an intracoronal filling? Remember that a key to success of pulpotomy procedures requires an accurate diagnosis of vitality and a good seal of the pulpal chamber. MTA materials cause hydroxyapatite to form on their surface, which produces a great seal at the pulp-MTA interface. But we also need a good marginal seal above the MTA to prevent bacteria from reinfecting the pulp. So our desire is to complete the sealing of the tooth above the MTA. Now, back to the original question. If you're going to place a crown on a tooth and the crown preparation is complete prior to performing the MTA pulpotomy, then there's no strong need to cover the MTA prior to cementation of the crown. The glass ionomer or the resin-modified glass ionomer luting cement will provide a very good seal over the MTA when the crown is cemented. However, a lot of times I like to do the pulp treatment before I prep the tooth for the crown. When I do the pulpotomy first, it reduces the chance for gingival hemorrhage entering the pulp chamber during the pulpotomy procedure. If you prepare the tooth for the crown after the pulpotomy, you should cover the MTA medicament. Otherwise, you may displace the MTA materials when you use the air-water spray of the handpiece during the crown preparation. Displacements can happen with any MTA products, but probably less so with NeoPUTTY and NeoMTA 2. NeoPUTTY is washout resistant, however it relies on the body fluids to set, which requires several hours. Covering the NeoPUTTY prevents displacement before setting. Now, NeoMTA 2 actually sets faster than NeoPUTTY, but covering it is the best way to prevent any leakage or displacement of the material that you've just carefully placed to protect the pulp. The AAPD guidelines for pulpal therapy generally recommend that a stainless steel crown be placed over a pulpotomy. However, they also state that if you have a single surface cavity on a tooth with a lifespan of 2 years or less, an intercoronal filling can be done. So, if you're going to place an amalgam or composite restoration over MTA, it's best to cover the MTA with another restorative material prior to placing the restoration. Alright, so we've established the instances when covering MTA is recommended. Now, concerning the second question, what should you use to cover MTA materials? A variety of materials can be used to cover NeoPUTTY or NeoMTA 2. For instance, a resin-modified glass ionomer, such as Biocem or Vitribond or any other resin-modified glass ionomer can be used. Glass ionomer cements can also be utilized. Some clinicians use IRM or ZOE, but regardless of what you use to cover the MTA, remember that a minimum thickness of 1.5 millimeters of MTA over the pulpal stumps is needed for optimal outcomes. Also remember, if you're placing a filling rather than a crown, use a strong, rigid material such as a resin-modified glass ionomer to cover the MTA medicament prior to placing the final filling. Resin-modified glass ionomers are light cured, they bond to the dentin, and they have a good compressive strength. Some clinicians may select a flowable composite covering, but if you use a flowable composite, you may etch the pulp chamber walls, but not the MTA material. And also, be gentle in rinsing the etch from the preparation so as not to displace the MTA material. When you're etching, please remember that MTA materials don't etch, nor do they bond to other dental materials. So the material overlying the MTA is needed to seal the margins, not bond to the MTA. To summarize today's Tuesday tip, when performing MTA pulpotomies, cover the MTA when tooth preparation is still needed after the pulpotomy, or when placing an intercoronal restoration over the MTA. You may choose to use resin-modified glass ionomers, ZOE, or even flowable composites without etching the MTA for your covering. Hey, I hope this information is helpful. Thanks for listening and have a great week.